Hello everybody, I'm Dr. Neeta Chavan from Pune. Today we are going to see pregnancy, the forensic aspect of pregnancy. It is also known as a gestation or fetation or gravidity. So the pregnancy by definition, a pregnancy is a physiological condition of having a developing fetus in the body from the time of the fertilization of an ovum by spermatozoon until the birth of a child. Since it is not possible to determine the precise at which the spermatozoon fertilizes the ovum, the exact moment of commencement of pregnancy is usually uncertain. So, about 7 days after fertilization, the ovum reaches in the uterine cavity and implants itself in the uterine wall. It is also customary to divide the duration of pregnancy into trimesters. So normally the pregnancy is considered as 9 months in a human being. So that period is divided into 3 trimesters, 3 months each trimester. And why it is required to divide into 3 trimesters? So because it facilitates both the ease of diagnosis, awareness of the problems, particularly at the each stage of the pregnancy. So there are certain problems which are in the first trimester, some are in the second trimester, some are in the third trimester. So to diagnose and treat accordingly, so that is divided into 3 trimesters. Then diagnosis of pregnancy is classified under 3 heads in the forensic part. So as per the forensic part, we are not dividing that pregnancy into 3 trimesters, but we are considering these as a presumptive signs, probable signs, and the positive or the conclusive signs. So presumptive evidence of pregnancy, mainly that is based largely on the signs and symptoms which are experienced by that female. Those signs and symptoms are known as a presumptive evidence of pregnancy. So now we will see which are the presumptive evidence of pregnancy. So these presumptive signs of pregnancy has some signs and symptoms as the secondary amenorrhea. So usually, though strongly suggestive of pregnancy, it is not fully reliable until 10 or more days has passed after the experience of the first day of the menstruation. It must be noted that there are some rare instances also of the pregnancy in a woman who have even never menstruated or who are at the early stages of menopausal. So during that stage also the female may become pregnant. So that secondary amenorrhea, it is not of much value as per the forensic part is concerned. Then menstruation may continue even after the conception. Even in some females, they remains on menstruating at each cycle of their menstruating date. It may be scanty or it may be like a regular, but it is a very rare condition. Then there are several causes of amenorrhea other than the pregnancy. So usually those are environmental causes, nutritional deficiencies, or so many organic diseases as a severe anemia, tuberculosis, some psychiatric causes or any hormonal disturbances. So these conditions may produces the secondary amenorrhea. Then there are certain mammary changes. So they are more marked in a primigravida. Primigravida, that is the woman who has become pregnant for the first time. So there are progressive enlargement and tenderness in the breast, then easily visible superficial veins. Then from the 4th month onward, colostrum will appear in the breast. So that means which consist of a free fat globules and large phagocytic cells which are filled with droplets of fat which can be squeezed from the breast. So that secretion is known as a colostrum. Then you can see in a diagram in the 2nd month, hyperpigmentation of the areola and the nipples occurs with the appearance of Montgomery's tubercle. So these are the raised spots due to enlargement of the sebaceous glands. So that appears only during the pregnancy. Then we will see what are the changes in the vagina. So that is known as the Jacquard sign or the Chadwick sign. So that is the bluish discoloration of the vagina, and Barney's sign. So that is the flattening of the anterior vaginal wall because of the uplifting of the cervix. Then there are certain symptoms present in the first trimester. So usually these are the morning sickness. So it is refers to the nausea which is followed by the vomiting soon after waking, or in the early morning nausea. In a common language we say early morning nausea and vomiting. So which is usually disappears on its own later on during the as the pregnancy advances. So like many other presumptive symptoms, this is also of not having reliability, because it is seen mostly in a primigravida only. Sometimes in a multigravida also it can be seen, but it may not occur in all cases. And then it may be also be a symptom of severe gastrointestinal disorders like a severe gastritis, acidity, or any ulceration, XYZ. So it may occasionally persist as a hyperemesis gravidum. Then the next one, it is the disturbance in a maturation. So such as increased frequency during the first trimester, and again a return to the normal as the uterus grows into the abdomen. And it again, that disturbance in a maturation or the increased frequency may reappear at the near end of the term ending, at the time of near ending at the delivery timing, because of the descending of the fetal head into the pelvis. So because of the pressure on a urinary bladder, there is an increased frequency of maturation. But again, this condition is also not reliable, because if there is any tumor, abdominal tumor or any intestinal, or because of the pressure from inside on the bladder, it may give rise to the increased maturation. Then there is a easy fatigability, hypersalivation, unusual appetite, increased irritability, hormonal changes. So it may be because of all those things. Then there should be a probable evidence of pregnancy. So first we have seen the presumptive signs and symptoms, so which are usually felt by the female, that who is supposed to be, or who is, we assume as if she is a pregnant. Then second one, it is the probable evidence of pregnancy. In that there are certain signs as abdominal changes occurs. So usually there are progressive enlargement in the abdomen after 12th week, so that the usually umbilicus becomes flushed with the skin. Then there is an increased pigmentation. So abdominal changes, so normally the pregnant uterus remains below the pubic symphysis level till the 12th week. After that, after 3rd month or after 12th week, it started getting up into the abdominal cavity, and after that you can see the enlargement of the abdomen. Then there are increased pigmentation. Increased pigmentation as there is linea albicans. So these are the lines, and progressive enlargement are merely signs of abdominal distension. So that pigmentation and pigmentation and linea albicans, these are appears because of the abdominal distension. So it may be because of any reason, like the ascites, that is the water accumulation in the peritoneal cavity, any tumor, like then huge enlargement of the liver or of the spleen. So it also gives rise to the abdominal distension or the severe fat accumulation. Then because of that, there may be an appearance of white marks. We commonly call it as a stria marks. Then there is a stria gravidum, so it is merely pronounced in a primigravidi. So that is the stria gravidum. Then stretch marks we know commonly known as, and the linea nigra. So linea nigra, that is the linear marking. Nigra, it is the dark line or the dark shade. So that is from the symphysis pubis to the umbilicus. Then there are certain changes occurs in the uterus. So the mucus becomes thick and a viscid plug appears, and which blocks the cervical canal to prevent the escaping the contents of the uterus. Then first thing we will here just discuss what are the abdominal changes occurs. So normally we said that the pregnant uterus remains in the below the symphysis pubis level till the 12th week. So as the pregnancy advances, it started becoming into the abdominal cavity. So slowly the size increases up to the umbilicus, then above that GP sternum. And then again, as the pregnancy advances, at the ending of the pregnancy, again the size resets or decreases as the head decreases and lodge in the pelvis for the delivery. Then next one, it is the, you can see here the stria gravidum, how it looks, and the linea nigra, so that is the dark line. Then there are certain changes as a Goodell's sign. So it can be first appreciated at the 6 to 8 weeks. So this becomes more and more patulous as the pregnancy advances, because these changes may also occur in acute cervicitis. These changes we cannot be considered, or we cannot believe or taken as a fully positive signs of pregnancy as per the forensic part, because these changes may also occur in acute cervicitis, in a hematometra, and a woman who are having a long-term regular uses of a combined contraceptive. So because of the use of that hormones, the Goodell's sign may become positive. Towards the same term ending, that is towards the ending of the pregnancy period, it is apparent shortening of the cervix, and the cervical canal becomes circular, and the external os admits the tip of the finger with ease to a greater depth. Then the next one, it is the uterine shuffle. So uterine shuffle, it is a soft blowing murmur which you can hear with the help of stethoscope, and it synchronizes with the maternal pulse, which can be heard with the stethoscope applied just above the midline of the inguinal ligament, usually audible from the 16th week onwards. Next, it is the Hega's sign. Hega's sign, that is softening and compressibility of the lower uterine segment. So first appears it at the 6 to 8 weeks. This sign is elicited by, so how will you check this sign whether the Hega's sign is positive or not? This sign is elicited by introducing two fingers of one hand into the posterior fornix, while the other hand rests on the pelvis just above the symphysis pubis. On pressing upward with the first hand and from above softly the other hand, it appears as if there is no intervening uterus between the two hands. So it feels as if these two hands can meet each other easily. So if it is occurs, so that means the Hega's sign is positive. So you can see here the Goodell's sign. So that means here you are putting into the posterior fornix and one hand is in the above the abdomen. So softening of the cervix, that is known as Goodell's sign. Second one, it is the Hega's sign. So you can feel these two hands. The next one, there is a Braxton Hicks sign. That is the appreciation of intermittent contraction of the uterus from 16th week onwards, which can be palpable on the abdomen. So usually it occurring at the interval of 5 to 15 minutes and each lasting for about 1 to 5 minutes. So if you put your both the hands on the abdomen, and if you can feel the contraction of the uterus, so it can be felt that the contraction usually appears at the interval of 5 minutes to 15 minutes, and it remains only up to 1 to 5 minutes. But you can, with your hands, if you can feel that contractions. So that if you can feel, that means the Braxton Hicks sign is positive. Next one, it is the ballotment. So as the name suggests, ballotment means tossing of a ball. So that is the method of eliciting the presence of fetus which is floating in the Leaker amni. This can be determined either externally or internally. So that means there are ballotment tests. It is external ballotment and the internal ballotment. So external ballotment, it is elicited by placing the palms of both the hands over the abdomen on the either side of the midline and just pushing firmly with one hand towards the other. So because of that, whereupon the impetus thus given to the fetal head, which can be felt against the other hand. So that means if you just tap from one hand and just push that from one side, that floating fetus get floated over that other hand side and you can feel it. So that is the external ballotment. Internal ballotment is done by inserting two fingers of one hand into the posterior fornix and pushing sharply upwards. The fetal head will first move upward in the Leaker amni and then it's again settle down onto the fingers. But that push should be a gentle push so that it will get just bounce softly and again it will rest on the two fingers. So that is the internal ballotment test. Then next it is the probable symptoms of pregnancy. We will see here now the symptoms. The only symptom that could be taken as a probable evidence of pregnancy is a quickening. So quickening means that is the first perception of the fetal movement which is felt by the mother. This is possible only from 16th to 20th week onwards and it increases in its intensity as the pregnancy advances. So there are certain requirement of laboratory investigations. So laboratory investigations for pregnancy, it is depending upon the increased level of human chorionic gonadotropin hormone in the urine. So using either biological or immunological method, the morning midstream urine of the woman suspected to be pregnant is used for this test. So the normally when we see that in the market we see the Prega test or the likewise test when there is a missing menstrual period and if that female feels or thinks that she is pregnant, so usually that test is done. So where the HCG from the urine is get checked. So for that purpose, the morning first urine of the suspected pregnant woman is used and again the midstream urine. Just only with the help of 1 or 2 drops, the test can be done. If the HCG is present in that urine, that means the test is positive and it gives the clue that the female is pregnant. But again, this test is not much of value or reliable as per the forensic part is concerned because there are certain other factors like the vesicular mole which again gives rise to the test positive. The other biological test which may are easy to perform but it is a time consuming, but it includes as Assessum or Zondek test, Friedman test, Hogben test, Galli-Menini test. All these tests are obsolete and only of the historical interest, having given way to the immunological test. Then the positive evidence of pregnancy. Then there are absolute or the certain and conclusive sure signs must be there, can be grossly appreciated only from 4th to 5th month of gestation onwards. So as per the forensic part is concerned, the presumptive sign, probable signs are not of having much value, only the conclusive signs which are considered as a or having a medico-legal importance as per the part is considered about the pregnancy. Now we will see the conclusive signs. So conclusive or the positive evidence of pregnancy, it includes the fetal parts and fetal movement. So it is a discernible by bimanual palpation. So this may be difficult when the abdominal wall is fatty or there is a hydramnios. So the fetal parts you can feel or the fetal movement you can feel by the bimanual palpation of the abdomen. So if you put your both the palms on the abdomen and if you try by the gentle pressing, try to shape out the fetal part or check the fetal parts, then you can say yes, it is a sure shot sign. But it is difficult when if the abdominal wall is too fatty or if there is a hydramnios, that means if there are too much quantity of Leaker amnios present and the baby is small, that time it is very difficult to ascertain the fetal parts, even the movements. Then the next test for that, it is the fetal heart sounds. So with the normal rate, usually the fetal heart sound, it is also known as a FHS. So it is 120 to 160 per minute, which sounds like a muffled tickling of a watch. This can be detected much earlier if more advanced techniques are used. So you can hear a FHS just by first you have to check the fetal parts so that you will get the idea of how the fetus is lying over there where usually the heart will be, and by putting your stethoscope on that area you can hear a fetal heart sound. But again, it may not be possible if there is a tremendous liquor amni is there, or fetal position in the uterus which cannot transmit that fetal harm. At that moment, that time, it is not possible to hear, but it can be here with the advanced technologies. Then the next, it is the radiological demonstration of the fetal skeleton, so which, although possible in some cases even at the 20th week of pregnancy, it is contraindicated during the first trimester. By ultrasonography, a small white gestational ring can be seen early as 6th week of gestation only, and the distinct echoes from the embryo within this gestational ring can be discerned by careful scanning 2 weeks later. So with the help of ultrasonography, we can get a sure shot idea about the evidence of pregnancy. So here you can see the gestational sac and the fetus. So usually it is of the 40 days old fetus only. So we will see now here the medical legal aspects of the pregnancy. So there are certain cases as a civil cases and the criminal cases. So in a civil cases, so there are malicious persons may align either verbally or in a writing that an unmarried woman or a widow is pregnant, in which case she would definitely want to prove herself. Then a concealed pregnancy before marriage or after marriage by a person other than lawfully wedded spouse would constitute valid ground for the divorce. The duration of pregnancy assumes importance when the legitimacy of the posthumous child is questioned. So these are the civil cases. In a criminal cases, pregnancy is positive proof of a sexual intercourse in a trial of rape. Then the pregnancy may be a motive for the suicide of a married or unmarried woman, or for the murder of a married woman by her husband, even it is the result abortion and a feticide or infanticide. In a civil and criminal cases, a woman may feign pregnancy. It is a conditioned term, a pseudopsychosis or a false or imaginary pregnancy, in order to avoid the capital punishment, to compel a person to marriage, then secure more maintenance in case of a divorce. Pseudopsychosis or pseudocyesis is also encountered in a sterile or infertile woman who long for children. It also to be considered here are the condition of superfetation, where 2 or more pregnancies result from the fertilization of 2 or more ova of a different ovulatory periods, and the superfecundation, that is in which 2 or more ova of the same ovulatory period are fertilized by separate act of sexual intercourse with the same person or 2 different persons. So although the superfetation is theoretically possible, it is not been demonstrated beyond doubt in a human female. On the other hand, superfecundation is not only a more likely possibility, but has also been described in a literature.